Before the closing ceremony, we would like to listen to the call to action that we have all gathered here to develop. And the chairperson of the editorial group, Professor John Catford, and Professor Luigi Oladepo will read the first 2 pages of the call to action. I would like you to then signal your approval in the normal mode by acclamation. So over to you, John and Luigi.
The Nairobi Call to Action identifies key strategies and commitments urgently required for closing the implementation gap in health and development through health promotion.
Health promotion is a core and the most cost-effective strategy to improve health and quality of life and reduces health inequities and poverty. In so doing, it helps achieve national and international health and development goals, such as the Millennium Development Goals. Implementing health promotion creates fairer societies that enable people to lead lives that they value by increasing their control over their health and the necessary resources for well-being.
The Nairobi Call to Action reaches out to WHO and other UN partners, international development organizations, governments, politicians and policymakers at all levels, public, civil society, non-governmental and private organizations and practitioners, as well as individuals, families, communities, community-based organizations, and social networks.
The Nairobi Call to Action was developed by participants at the 7th Global Conference on Health Promotion, Nairobi, Kenya, in October 2009, hosted by the World Health Organization and the Republic of Kenya. Over 600 experts from more than 100 countries participated, including ministers of health, politicians, senior public servants, health practitioners, policymakers, researchers, teachers, and community representatives. They were complemented by an equal number of virtual participants who registered on a new social networking site. Utilizing multiple participatory processes, the call to action was developed during the 5-day meeting and is complemented by a full conference report and a series of technical papers.
The call to action aligns with the aspirations of member states, reflects the vision of the Alma-Ata Declaration, and support the recommendations of the WHO Commission on the Social Determinants of Health. The call reaffirms the values, principles, and action strategies of health promotion codified in the Ottawa Charter for Health Promotion in 1986, and in subsequent global health promotion conferences, including the Bangkok Charter for Health Promotion in a Globalized World in 2005. Which has been confirmed by member states through the World Health Assembly.
Health promotion has demonstrated its effectiveness and return on investment at local, regional, national, and international levels. Although many of the challenges that drove the development of health promotion remain the same, new threats continue to emerge or escalate rapidly. Health promotion can greatly contribute to tackling development and equity challenges and to the realization of human rights. However, implementation gaps exist in evidence, policy, practice, governance, and political will, resulting in a failure to realize this potential. This represents a lost opportunity measured in avoidable illness and suffering, as well as the broader social and economic impacts. Global commitment.
We, the participants of the Global Conference on Health Promotion, recognizing the changing context and acute challenges, call on all governments and stakeholders to respond urgently to this call to action and strategies and actions that follow.
To use the untapped potential of health promotion, we pledge as champions to use the existing evidence to prove to policymakers that health promotion is fundamental to managing national and global challenges such as population aging, climate change, global pandemic threats, maternal mortality, migration, conflict, and economic crises. Revitalize primary health care by fostering community participation, healthy public policy, and putting people at the center of care. Build on the resilience of communities by harnessing their resources to address the double burden of non-communicable and communicable diseases.
To make health promotion principles integral to the policy and development agenda. We call on all governments to exercise their responsibility for public health, including working across the sectors and in partnership with citizens, in particular, to promote social justice and equity in health by implementing the recommendations of the WHO Commission on the Social Determinants of Health. Accelerate the attainment of national and international development goals by building and redistributing resources to strengthen capacity and leadership for health promotion. Be accountable for improving people's quality of life and well-being.
To develop effective and sustainable delivery mechanisms, we request member states to mandate WHO to develop a global health promotion strategy and action plans with regional follow-up that respond to the major health needs and incorporate cost-effective and equitable interventions. Strengthen its internal capacity for health promotion and assist member states to develop sustainable funded structures and set up accountable reporting mechanisms for investment in the promotion of health. Disseminate compelling evidence on the social, economic, health, and other benefits of health promotion to key sectors.
Acting together, developing and developed countries are facing a surge of preventable disease that threatens to undermine their future economic development. 5 urgent responsibilities for governments and stakeholders. Strengthen leadership and workforces. Maintain health promotion. Empower communities and individuals. Enhance participatory processes. Build and apply knowledge. The Nairobi Call to Action for closing the implementation gap in health promotion has strong global support, is urgently needed, and will make a profound difference to people's lives.